Hi, thank you for joining this workshop on prevention of prescription medication use. My name is Kelly Rankin, and I'm joined today by Jessica Giffen. We are substance abuse prevention specialists out of the Office of Student Safety and Wellness. I am assigned to the Langley and McLean pyramids, and Jessica is assigned to the Lake Braddock pyramid. So here's a little bit about the substance abuse prevention specialist position, also known as SAPS. So there's a SAPS assigned to every pyramid. We do discipline and non-discipline referrals, community presentations, parent presentations. We also work closely with the PTSA and parent liaisons. We provide psychoeducation, early interventions, brief counseling, and connection to the outside resources if that's necessary. Parent permission is required before working with your student. So the Virginia overdose rate for all drugs and substance misuse was at an all-time high for 2020. So we'll walk you through to recognize some of the signs and symptoms of prescription medication misuse. What are some of the risk factors and protective factors for tips? Throughout this presentation, you'll see several QR codes that you can scan using your phone, and that will link you directly to some resources. So let's start with the basics of what's in your house. So here's an example of a medicine cabinet, maybe in somebody's bathroom. So it has, your basic, Band-Aids, thermometer. So let's take a look at some of the prescription medications that might be in there. So opioids. So normally it starts off with a legal prescription, let's say from wisdom teeth or sports injury. So an example of opioids are codeine, morphine, Vicodin, and Percocet. So these medications are highly addictive. Death rate due to overdose has risen over 9.4% this year. So now we're going to look at another medication that's commonly abused, which is benzodiazepines. So this is an anti-anxiety medication that's commonly prescribed, and it is highly addictive. And it absolutely should not be mixed with alcohol. It acts as a depressant on your system, and so does alcohol. So you kind of get that double dose. So another important thing that I'd like to mention is, for our kids, there's an imitation on the street. You can see the picture here where it has the bar. So they're called bars, and so somebody is making these to look exactly like a Xanax, and we really don't know what's in there and what our kids are getting. So another commonly prescribed medication is stimulants. Often our adolescents are diagnosed with an ADHD, and so they get prescribed Adderall, Ritalin, or Concerta. So this is a medication that's often shared amongst our youth. So what are some of the signs that it's being misused? So if you're running out of medications before the 30 days, and this is happening more than one month, that's an indicator that maybe they're taking that extra pill and sharing that with their friend. Or if someone's constantly saying, "Oh, I lost a pill." So if this is a behavior that you're seeing more than once a month, then it's a good indicator that that medication is being shared. So now we're going to take a look at the impact of the overdose rate in Virginia. So how did 2020 compare to 2019? So first we'll take a look at the non-fatal ER visits in Fairfax County. We'll take a look at the overdose for all drugs in Virginia, and we'll take a look at the fatal overdoses in Fairfax County. So here's the comparison of 2020 to 2019. So you can see the blue here is 2019, and up here is 2020. So you can see that there's a pretty significant difference here. So let's break that down by age group. So this graph may seem a little confusing, so let's take a look at that. So this darker blue line here is our younger, up to 17, 0 to 17 was the data that we entered. And so you can see pre-pandemic, there was a rise, or pre-lockdown, you can see there was a rise in ER visits, and even in March, and then a significant drop after March. And it didn't really go up too much. But then you look at the next age group of 18 to 25, which is this orangish. We're kind of in the middle, but you can see here in October there was a significant spike. And then the next age group is 26 to 35. It's kind of this gray. And so what we really see here is that our school age kids were not the ones that made this rise in ER visits. It was our older adults, and the 18 to 25-year-olds, had that big jump in October. So here we are with the fatal overdoses in Virginia. So we don't have the fourth quarter data in yet. They're still processing those deaths, and so it's expected to be in by the end of the month. So this is where it's predicted to be, is up here. So you can see this significant jump. So the position of the substance abuse prevention specialist was created in Fairfax County as a result of 2017, because at that time it was at an all-time high for overdoses. So the opioid task force funded the position of the substance abuse prevention specialist in Fairfax County. So you can see in 2020, there's a significant increase. So let's take a look on how did Fairfax County do. So I like to look at 2017 as the baseline, because this was when our position was created. So you can see there was a drop in 2018. It remained about the same in 2019. And then you can even see here where it's about the same in 2020. But keep in mind that the fourth quarter data isn't in yet, so this is expected to go up a little bit. It might not be too much, but this number could possibly change. So when you look at 101 overdoses, let's break that down to how that impacts the community, right? So when you look at it as a family, it affects the parents, the siblings, grandparents, cousins, first cousins, friends, pets that are left behind, and schools and entire communities. So what we're looking at, this age group of overdoses, it's typically in mid-20s to early 30s are the ones that are overdosing. So we're not seeing this behavior in high school, the misuse of opioids, but the behavior does start. So let's take a look at what that looks like in the stages of addiction. Okay, so let's start off with our 7th and 8th graders. So they're not even really on this line of use or misuse. This is where, the peer pressure begins. Maybe they're stealing from the household, alcohol, cough medicine is a big one. And again, we want to look at what's in your medicine cabinet. Are they taking, the leftover opioids that were from somebody's wisdom teeth, or maybe a family member had knee surgery and they have the pain medications in there, just in case another injury happens. And this is also where, the older sibling or an older family member may introduce them. So it's important for family members to know that at some point, the possibility of your child being introduced to something is likely. So you want to role play scenarios so that they know what to do when that happens. So the scenario that I like to teach the kids is, always blame an adult. My dad is crazy. My mom is crazy. If they find out I'm vaping, or if they find out I stole their alcohol, they're gonna go crazy, or I'm gonna lose my phone. So they have that that protective factor to use. And role play that and have that conversation early and have it ongoing, as they get into 6th, 7th, 8th grade. 9th grade is a little bit different, where they might know friends that are using. And the youth survey shows a significant jump between 10th grade and 12th grade every year. So this is where they're starting to drive. This is where maybe they have a job, so they have some money. So you want to make sure that this conversation is ongoing. as your child progresses through Fairfax County. Then we get into experimenting. This is where the underage drinking is, sharing of medications. Again, what's in your medication cabinet, trying multiple substances, really high risk behavior. So some of the thinking errors that we see with this is I won't get caught, I'll never get addicted, or everyone is doing it. Right? So some of these behaviors, that are ongoing really work their way down towards misuse. For example, binge drinking. So part of your conversation needs to be, what will it look like for you when, you're like, draw this imaginary line here of when you're no longer just experimenting, and have that baseline. When I'm, so it comes from your child. When I'm doing this behavior, that means it's starting to get out of control. So the next indicator of that you're moving down the line is the increased tolerance. So our brain produces dopamine naturally, like when we have food and exercise and music. So when you do drugs, it goes above what we get naturally. For the adolescent, they're going to say, that's amazing. I like that. I'm going to do it again. So then what happens is our brain needs more dopamine just to feel that pleasure again. And how did they get it? They got it from drugs. So, and so you need more and more drugs to produce that dopamine. And that's really where the tolerance is increased, and that leads to cravings. And this is where the withdrawal comes in as well. So the next step is preoccupation. So when we're talking about prescription medication use, to get these pills, let's say they did take them from the medicine cabinet, and now they've run out. They've run out of a way to get these prescriptions, and the cravings and the withdrawal have increased. So the preoccupation is, all right, how am I going to get the money to get it? Who am I going to get it from? I really feel this withdrawal, and I don't like what I'm doing. So the self-talk revolves around, getting these pills in order to get through the day. So, by self-talk, I mean, a lot of times people don't share, wow, I really feel like I'm getting addicted to these pills, I need to cut back. Or let's say it's alcohol, I really feel like I'm drinking too much, I need to cut back. It starts with that self-talk of not wanting to do it. I'm only going to drink on weekends, or I'm not going to use pills throughout the week. And you're not able to be successful with that. So this is where, the parents really start to set a boundary, and start talking about getting help. So remember, you had your conversation back here when, they were caught maybe experimenting, and they said, if I'm doing this, if my grades drop, or my friends change, or then that means that I need help. So you go back to your conversation that you had before. So the other thing that you really want to look at is friends who are concerned. The common thing is they're worried about getting their friends in trouble. So you've got to look at, am I getting my friend in trouble, or am I possibly saving their life? And the other thing you want to really look at is enabling behaviors. Are you making excuses? Oh, they're just tired, and things like that. Okay, so the next indicator that you're moving down the line more, abuse to dependence, is this loss of control, the amount, time, and place. Right? So you've had that self-talk of, I'm not going to use during the week. I'll never put a needle in my arm when we're talking about prescription and opioid abuse. And your broken promises to yourself are broken. Right? So, to get these prescription medications, to come up with this money on a daily basis is really, really difficult. And so this is really where risky behavior comes in, with the stealing, to get your money. And so often, when you're getting these pills, this is not like a reputable source. It's a business for these people that are these drug dealers. So they may say something like, you're spending a lot of money, and I know how hard it is for you to get the money to get these pills. Why don't you try this heroin? It's quicker, it's cheaper, it's easier. And at this point, the withdrawal is so bad for opioids. And by withdrawal, I mean, so what's happening for an opioid addict is So our brain produces this natural endorphin that helps us manage pain. And so when someone abuses opioids, the brain, it gets on the same receptors that for our endorphins. So the brain says, well, I'm making endorphins, so therefore I'm not going to make it naturally anymore. So when somebody doesn't have pills and the brain has stopped producing these endorphins like it's supposed to, there's a period there where there's nothing to manage pain. So somebody who's in active withdrawal, it hurts to brush their hair, it hurts to take a shower, and it's really that intensive flu-like symptoms of body aches that is horrific, and they just don't want to feel that way. And so this is where the preoccupation comes in of how am I going to get it so I'm not feeling that way in the morning. And so when somebody introduces them, that's easier to get. You don't have to get as much money in the morning, and introduces to heroin. It's a quicker fix. So here's where they continue to use despite consequences. At this point, the person is unemployable. There's serious legal issues possibly. Um, Definitely family issues, and there's no benefit from use anymore. In other words, they're not getting high anymore. They're really only using to manage their withdrawal symptoms. So now we're going to take a look at what are some of the risk factors that really gets addiction starting. So first, we're going to start with this column here with mental health and depression. So, I've worked with adults for a very, very long time, and a lot of what they say is early on in adolescence, I had high anxiety that was never addressed, or depression that was never addressed. So what happens? They self-medicate, right? Alcohol, will calm their anxiety, right? So we're looking at, some of these drugs that are early on. Remember, not starting out necessarily with opioids. It starts off with, the vaping, the alcohol, and possibly something whatever's in the medication cabinet, and they really like that high, and then the dopamine gets increased and they're looking for that, the ultimate high, and that's where they may be introduced to pills at some point. You want to also look at the family history of addiction. When you're having that conversation, talk about the aunt, the uncle, the grandparent who had that family history of addiction and that they're predisposed. So then we're going to look at what's called the adverse childhood experience. It's called ACE. So this was a study that was done by Kaiser Permanente back in the early 90s, and the CDC collaborated with them. And so what they looked at were some of these older adults and events that happened in their childhood that caused them to have either addiction or some kind of chronic illness, diabetes, heart disease, kidney disease later in adulthood. And what they saw was in early childhood, there might have been some unresolved trauma. Maybe the early attachment phase was missed. So there was something significant in their childhood that wasn't addressed that led to this self-medication. We could almost put this arrow over here as well. So. And then also that lack of community resources. They weren't playing a sport. They weren't involved in their, in their community or in their school. Lack of friends that could lead to misuse. So you want to make sure that you're getting all this stuff addressed. In their childhood, whether it's trauma and the trauma can be something small or it can be something significant. It could be something as simple as a bicycle accident. The bullying throughout high school is big, or it could be the loss of a family member or a family pet, that was significant. So make sure that they're getting treatment and some sort of therapy for that. So we already talked about the medicine cabinets. So I can't stress this enough. You don't want to save your leftover medications. There's no reason to be doing that. And we'll talk a little bit later on about how to dispose the proper way to dispose of these medications. So again, with opioid addicts, they usually get introduced through a prescription medication. This could be through a sports injury. This is a time when wisdom teeth are coming out. And the dentists have definitely gotten better about prescribing. A lot of them don't say, well, here's 30 days worth of medications. Honestly, when somebody gets their wisdom teeth out, the pain is maybe a week. If it extends on to 30 days, you need to go back to the dentist and find out, what's happening if it goes past that 7 days. And again, no reason to save any leftover pain medication. You want to dispose of that properly. So with that, I'm going to pass this over to Jessica. She's going to talk about protective factors associated with opioid use.
Thank you, Kelly. So next we're going to take a look at signs of prescription medication misuse. So signs with opioid misuse would look like constipation, nausea, feeling high, slowed breathing rate, drowsiness, confusion, poor coordination, increased dose required for pain relief, worsening or increased sensitivity to pain with higher doses. Signs of misuse with benzodiazepines would look like drowsiness, confusion, unsteady walking, slurred speech, poor concentration, dizziness, problems with memory, and slowed breathing. Signs of misuse in stimulants would include increased alertness, feeling high, irregular heartbeat, high blood pressure, high body temperature, reduced appetite, insomnia, agitation, anxiety, and paranoia. Other signs of prescription medication misuse would be things like poor hygiene, sudden changes in grades or behavior, excessive mood swings or hostility, increase or decrease in sleep, poor decision making, could be stealing, forging, selling prescriptions, maybe taking higher doses than prescribed, requesting early refills, or constantly losing prescriptions or losing pills so that more prescriptions have to be written, and seeking prescriptions from more than one doctor. So I think it's important to highlight the signs of potential overdose, especially after Kelly shared the different rates and statistics about current overdose rates in Virginia. So we'll start with talking about opioid overdose. So an opioid overdose might look like loss of consciousness, unresponsive to outside stimulus. They might be awake but unable to talk. Breathing can be very slow, very shallow, be erratic, or could stop altogether. Skin tone could be bluish purple, or it could be grayish ashen color depending on the skin tone of the individual. There might be choking sounds, snore-like gurgling noise. Sometimes it's also known as a death rattle. There could be vomiting. The body could be very limp. Face could be very clammy and pale. Their fingernails and lips might turn blue, purplish black. The heartbeat could be slow, erratic, or not there at all. It is extremely important with an opioid overdose to call 911 immediately. It's also important to have Narcan nasal spray on hand for overdoses. So Narcan nasal spray is used to temporarily reverse the effects of opioid medications. It is important to note that depending on how much the individual has taken, it may require more than one dose of Narcan in order to revive the person. So I would recommend obtaining more than one dose if you can. Narcan can be obtained from your pharmacist without a prescription. If you're interested in learning more about how to properly use Narcan, which is also known as naloxone, the Fairfax County Community Services Board provides a free virtual training right now. It's called Revive Opioid Overdose and Naloxone Education. So scan the QR code to register for the training. So signs of a potential overdose with benzodiazepines would look like dizziness, confusion, drowsiness, blurred vision, slurred speech, responsiveness or weakness, anxiety, agitation, difficulty breathing, glue in the fingernails or lips, uncoordinated movement, tremors, altered mental status, and coma. I also want to point out that overdosing on benzodiazepines alone may be better described as oversedation, because fatal overdose on benzodiazepines alone is unlikely. However, you should be aware that the risk of combining these benzodiazepines with alcohol or opioids is really, really harmful. So benzodiazepines are central nervous system depressants. And so when you combine them with other depressants, it can result in suppressed respiratory systems and potentially death. So it's extremely important that if you think that there is a potential overdose on benzodiazepines, to call 911. So signs of potential overdose with stimulants would include extreme anxiety, paranoia, panic, hallucinations, extreme agitation, aggressiveness, restlessness, and hypervigilance. I should also note that overdosing on stimulants is also known as overramping, and in some cases, a stimulant overdose can cause stimulant psychosis. And depending on the specific drug that has been taken, it can include paranoia, the auditory or visual hallucinations, delusions of persecution, and some people have also experienced suicidal thoughts. So it is also important to call 911 immediately. So now let's talk about the protective factors and what we can do as parents, educators, and community members. So the Fairfax County Youth Survey shows that children and teens with 3 or more protective factors are more likely to be able to manage their stress better, make better choices, and develop healthier habits. So the many factors that help children and teens succeed include having parents or guardians who are available to help, participating in after-school activities, having adults in the community to talk to, accepting responsibility for their actions, and having teachers who recognize and praise good efforts. So one thing that stands out to me with many of those protective factors is the connection. So I love this quote by Brené Brown that says, "Connection is the energy that exists between people when they feel seen, heard, and valued, when they can give and receive without judgment, and when they derive sustenance and strength from the relationship." So youth who experience strong developmental relationships are more likely to report a wide range of social emotional strengths and other indicators of well-being and thriving. Youth with strong relationships are more resilient in the face of stress and trauma, and youth do better when they experience a strong web of relationships with many people. So what can you do? What can we as parents, teachers, educators, neighbors, coaches, and community leaders do to ensure that our youth have as many protective factors as possible? So we can be available to help our kids. We should know where our children are, know who their friends are, know where they're at. Involve our children in family decision making, help them to feel valued and heard. Show respect for all family members. Communicate clear disapproval of drug and alcohol use. This is extremely important, as the Fairfax County Youth Survey, as well as many other youth surveys across the country, have shown significantly that when youth know that their parents strongly disapprove, they're more likely to not use substances. Educators, recognize and praise good effort. Present opportunities to be able to talk with your students one-on-one. Discourage bullying and cultivate a feeling of safety. And foster open communication with parents, even when students are doing well. And neighbors, coaches, and community leaders, be caring community members who are available to talk to the teens. Communicate, again, clear disapproval of drug and alcohol use. It's so important. Encourage participation in after-school activities. And again, give positive feedback and recognize good effort. Other prevention strategies include monitoring use of prescription medications. So that could be counting your pills. Make sure you know how many you have in each bottle and keep track of that. Make sure you know when pills are missing. Understand prescription medications and how they interact. Not just the ones that you take, not just the ones that your students take, not, for the whole family. Understand how they all interact. Talk to your doctor about all the prescriptions in the home and what are the risks associated with how, if those prescriptions happen to get into the wrong hands. Lock up prescriptions. We have medication lock boxes that you can use to lock up your family's prescriptions. If you need one of those, please feel free to reach out to me and I can help you obtain one. Discard unused or expired prescriptions. I'll talk more about that on the next slide. Parental supervision. Again, that goes back to the last slide of knowing where your students are, knowing where your kids are, knowing who they're hanging out with. Be present in their lives. And talk with your child about substances. Start the conversations early. I know, they're hard conversations to have, but don't shy away from them. Ask them what they know. You will be surprised at what they know, and then you just build upon that. Help them, educate them about if they have a misconception. Our kids love facts. They love knowledge. Give it to them. Get teens involved in sports and activities and clubs. Basically, any activity that brings them joy, that is safe and positive for them and helps them to connect to other individuals. Obviously, I know this can be extremely difficult during a pandemic, but we have to find ways to get creative in creating activities that our students can do safely. Be a positive role model. And lastly, get treatment for trauma, grief, family addiction, mental health concerns, etc., whether for the child or for the family. So we wanted to highlight safe ways of disposing of unused or expired prescription medications. So the DEA has a National Prescription Drug Take-Back Day that they do twice a year. The next one is on April 24th. So make sure to look in your local communities to find out where your drop boxes are located for that event. Also, if you scan the QR code below, you will be able to see how to safely dispose of medications if you don't have a drop box available to you. So you don't want to flush it down the sink or flush it down the toilet, get into our water system, etc. So there is a whole protocol of how to safely dispose of your medications. Here are a couple of QR codes to lead to some resources available to you. So we have the Fairfax County Community Services Board. We have some drug facts for you, and the link to the Fairfax County Public Schools Substance Abuse Prevention Program that Kelly and I work for. And lastly, feel free to contact Kelly or myself if you have any questions. Our contact is below. And again, we are substance abuse prevention specialists with Fairfax County Public Schools. Thank you.